Today we are extremely happy to have Dr. Ouassim Salmi with us today. He's going to go over a introduction into Modjaw, which is a revolutionary product that's going to allow you to do real-time jaw motion tracking, institute your CBCT, your intraoral and face scans to give really a dynamic way to show your patient what treatment planning is going to be, have them involved in it, and just some really great steps to really enhance the dentistry that you are doing. Without further ado, I will hand this off to Dr. Salmi.
Thank you very much, Daniel. Thank you very much. I'm so happy to be here to talk a little bit about 4D dentistry, and thank you very much for having me. So I will share my screen and let's start. Let's talk about 4D dentistry. Thank up, done. So we are going to exchange a little bit, and I will do an introduction to 4D dentistry. When we talk about 4D dentistry, is when we add time. This is what I'm trying. We add time to 3D dentistry. So 3D dentistry, 3D models, 4D dentistry, 3D models moving in real time. So before I talk about that, I just want to take you a little bit to the history, from where everything, a little bit of history, from where everything was started when we talk about jaw motion. That didn't start with Modjaw. It starts a long time ago. And then in the middle, I will talk a little bit about motion capture that was used in something else than dental. And then we'll finish talking about Modjaw, how we do Modjaw, what is Modjaw, and how we can use it in the daily workflow to enhance our way of working. So when we talk about the history, I choose to start from the 17th century. So 17th century is remarkable because this is where studies about the lower jaw started to be here. According to Antoine Ferrand, this is the first thesis about the anatomy of the temporomandibular joint and everything. So in the 17th century, it was just about anatomy. And then in the 18th century, we start seeing a little bit of casts, position of the lower jaw. And then this is also the first time where we talk about the tracing of how the lower jaw is moving in the end of the 18th century. But far from dental, in the 18th century, this is where Edouard Muybridge gave life to pictures. So it was a debate between artists that are painting horses, like in different wars, and race painters who are painting horses where the legs are not touching the ground, and the others with two legs are touching the ground. So there is a debate. Is there like a time where the horse is not touching? So this is what Edouard Muybridge has solved, like by giving life to pictures. He pictures like different images from the patient, from a horse galloping, and then he said, yes, there is a time where the forelegs of the horses are not touching the ground. So this is just between brackets. Let's move now to the dental and to the next centuries. So the 19th centuries, we start seeing more and more details, more and more sophisticated devices to be able to record motion, according to the work of Bennett, McCollum, Landin, and Slavicek. And we start also seeing the first articulator to simulate the movements. And then we start also seeing the virtual imprint in the 19th century. But what I like in here is this video in here that you can find on YouTube. This is the replicator, the first time that we try to record some motion, like this is jaw motion. This is Landin and Gibbs trying to record, but it was clinically not applicable because all those things can be recorded, but then how you can use them in real life. So then I will move. And then we arrive to 20th century. So between 2002 to 2017. I call that evolution, because all what we've seen before in the previous century, we start seeing some sophisticated devices to trace, and also some sophisticated articulators like the SAM, some virtual articulators, but also virtual imprints. AUS scans to have 3D models, and also CAD softwares. So now we start seeing like an image about a normal workflow. What can be like you scan, you have the 3D models, you put inside an articulator, you trace if you want, and then you put inside a CAD software. So, and then far from dental school, we talk about cinema. So in the 18th century, Muybridge captured the horse, and here the motion capture was used in cinema. So this is Avatar 2009, and you can see like on the right side, the camera capturing the movement of the actor, and this movement is used in an animation movie. So this is just between brackets also. This is what I call also evolution. So from the beginning, when we talk about the 70th, the 90th, the 80th, the 90th, and the 20th centuries, when we talk about those devices, in all the articles, you will find that those devices will help you to do a diagnostic and also a treatment plan, and how they can help. So if we go a little bit in depth, what you can get from the devices that you have in the left side is more this kind of tracings. So in terms of clinical applicability, it takes a lot of time to trace, and then you will have those tracings, and it's so complicated also then to interpret. But then what you can get like an outcome is information to program a simulator. So it was just like you do all this work, and then to be able to simulate the movement, it was a little bit, for practitioners, mind-blowing. You know, you spend all the time to be able to simulate the movements later, but you still have adjustments when you do the treatments. And this is where I call, like in 2017, Modjaw like revolution. So we started evolution, now it's the revolution. Why? Because it's in the continuity of a treatment planning, of a normal workflow, of a daily workflow. You scan the models that you can see on the right side, 3D scans, and then you have trackers on the patient, and according to the camera that you have in here, you will be able to record real motion of the patient. So the set of data is not anymore just static, but also dynamic. So I have patient in MIP, and then you will be able to record all the motion inside the software, starting from 3D models using some trackers like the frontal tracker and the mandibular tracker. And the aim of that is going to be the same of what we said before, but it's more clinically applicable. Because as I said, it's the continuity of the daily work. You scan, you have static, you put them inside Modjaw, you have dynamic. And using all this dynamic, you'll be able to enhance the diagnosis and the treatment planning. You'll be able to check how the contacts are inside the mouth of the patient in the initial situation, and also in a project before putting it inside the mouth of the patient. So if you enhance the diagnosis and the treatment planning, you will be able to have and to improve the clinical outcomes. If you apply some dynamic information to a design like crowns, bridge, full arch, splint, you are going to avoid the adjustments that you will do after, because the project is already adapted to the patient. So you will improve the clinical outcomes, and we say clinical, improved clinical outcomes says like patient satisfaction. And then, like a logic, if you reduce the time of treating the patient and you increase the precision and the clinical outcomes, you will have an increase of practice profitability. So now we'll talk about dynamic dentistry anytime, anywhere, and for all. So for this part, I will take you through the way you record the motion. So what are the steps to be able to go from a virtual 3D models in static to a virtual real movement of the patient? What is the protocol? And then we'll go a little bit farther in the different functionalities. You need to know that the software, you have different functionality, different levels of user functionalities. Excess is basic, advanced is more. You push the level to the next step, and aesthetic, as its name, is to use like the photo and the picture and the face scan of the patient to be able to use those data in a functional way. And then we'll finish in this part with the data integration. So the protocol needs to be like full. You record, you analyze, and then you share with the lab to be able to use the information in the lab side. So we'll start with the protocol. As I said in the beginning, the protocol starts by importing the 3D models that you have recorded with your AOS, upper and lower jaw in a static occlusion. You put them inside the software. It can be an STL, PLY, or OBG, which means that it can come from any internal scanner. Then you will calibrate the tally, the tools, as you saw like a few minutes before, and then you are going to set up the trackers. You don't have plenty of trackers. You don't have one-handed of trackers. You have two: frontal tracker, mandibular tracker, and this is what the camera will capture in the 3-plane of space. And then you will acquire some extra oral points to tell the camera where is the patient in the 3-plane of space, and then acquire the intraoral points. Just like if I give an example of Facebook, I'm not sure that everyone is using Facebook today, but by doing that, you'll be able to put the models in your virtual patient in the 3-plane of space. And then you will be in live recording. Patient is moving, the models are moving at the same time. So it's easy to the patient also to understand what you are doing, and easy also for you to explain what you are doing. So in terms of time, it takes between 10 to 15 minutes. So which means like for the first recording, you can take like 20 minutes, but once you are outside of the learning curve, I do it now in 9 minutes. So you finish the recording, you can say goodbye to your real patient. This is why we talk about the game changer, because here you are going to work on your digital avatar, your digital patient. You don't need any more the real patient. No more share time for that to have a diagnosis and also a treatment planning for your patient. So once you finish the recording, you are going to use the different functionalities to discuss with the patient. And to discuss with the patient, you have different levels to analyze. So we talk about access, which is basic, and one of the main functionalities inside is the contacts. You can apply the contacts. When I say contacts, think about articulating paper that you are using in the clinic, in the clinical part. So put articulating paper, the contacts, adjusting everything. Here you will have the contacts in static, but also in dynamic. You can explain to the patient why you have this weird facet, why you need to adjust that, why you need to change that. It gives you an image to explain that, and not just like a color inside the mouth of the patient. For advanced, it's more to push the use of the software where you have the tracing combined with the 3D models, the virtual articulated parameters, and you can add the CT scan inside if you want. And for aesthetic, like the name, who says aesthetic means that you can import face scan and image, have some face proportion, and also use one of the main functionalities of the software, which is the OVD shift. Changing the position of the lower jaw, raising the bite using Modjaw is a game changer today. Just like in terms of precision, in terms of simplifying the workflow, it's a game changer. So now I will take you through a software review quickly to show like 2 or 3 cases on the software. So I will start with a simple case. So I have upper and lower, did the recording, and I will talk about the access module, where I will show you just the main functionalities, which is the contact. So here, if I close all those functionalities in here, you can see the models in here. I can replay the movement of the patient that you can see in here. And then this is what I was talking about, this functionality, which is the contact. I turn models like that. I put a little bit of transparency. Look at this. The articulating paper that we are using is one color, okay? Here you have different colors that explains to you how heavy is the contact and when the contact is there. This is what I'm telling you, because when you do an articulating paper, you have contact everywhere and you don't know at what time the contact was there. So here, if I want to explain to the patient why this lateral has a weird facet in here, it's easy for me to explain because he can see that. And then what makes more like interesting this platform is to use this access module, but in a project, which means that if you ask the lab to do for you a proposition for the lower jaw, like a DSD or digital smile design or smile creator or whatever we want, you can import it inside the software as an STL file, and you can try it inside the software without or before putting the project inside the mouth of the patient. This is the initial situation for the patient. And then I can just put the STL of the wax up. I can ask the software, can you please give me the contacts on my additional model? And look at this. You can see the adjustments that you will do before you put it inside the mouth of the patient. But better, you can ask the lab to adjust before producing the project to put it inside the mouth of the patient. So this is what access is all about. Now to go to advanced module, I want to change the patient to go for a patient where we have more data. I was talking about the CT scan. So the CT scan is something that you can add. So as you can see here on this patient, and then the recording is always done by the 3D models, but you can take it to the next level and import more models inside. So here, for example, if you replay the movement of the patient, the recording was done with this, just the 3D models. But then if you import the CBCT inside, poof, that gives you an image. Okay, so if you want, for example, to compare the position of the condyle in 2 different positions, you will choose something so interesting, which is the cat view. I really like this functionality. Here, if I put the cat view between the condyles, for example, look at this. If I put the scalp, when the patient is moving, you will be able to see how the condyle is moving. Look at this. and then go back to the starting position. So in terms of analyzing where the condyle is, so if we want to take it to the next level to discuss, for example, when you change the position of the lower jaw and you want to check, or maybe after a treatment, to check where is the condyle, so no need anymore to do a second MRI or the second radiography. You have it in here, you move it, and you will see it in the 3 plane of space. And you have also the articulated parameters that are automatically measured inside the software. You don't work anymore with average values. And then when we talk about aesthetic, I will go back to the same case in here that I imported before. You can have an STL, or you can have the face scan of the patient that you can add as an additional model, like in this case. And once you add it, you will be able to have what we call the face proportion, so you can explain for the patient if there is an indication to rise the bite. And then if there is an indication to rise the bite, you will use the movement of the patient. I told you before that 1 second of recording inside Modjaw is 120 images, which means 120 mandibular position. Imagine that you can move frame by frame, and each position you recorded inside the software can be exported to the lab, which means if I want to export this one, if I want to rise the bite, imagine I use a leaf cage. Ask the patient to open, put the leaf cage inside the mouth, ask him to close, and I will have this position. I don't need any further step. But more than that, you can analyze this position. You can see how much space you have anteriorly between the incisors, for example, when I will just adjust it a little bit like that. And if you add, do you remember, if I add the STL of the project, it gives me a perfect image and I can see. And more than that, you can put the cut view posteriorly between the molars, and you can check also how much distance you created, if the project will fit. It's a discussion between you and the lab. So this is what we'll offer Modjaw. Once you decide about it, you just click on OVD shift current position, and all the movement will start from that. So it's not just static, but also dynamic. You will give this position and the movement you already recorded to the lab without any further step. No scan, no injection of silicone, no wax, nothing. It goes straight to the next step. So those are a few functionalities that I wanted to share with you in here. Now we'll move to the next part, which is to integrate the data inside the CAD software. Because recording is cool, perfect, analyzing is also perfect, and then I need to take this to the lab. This is why we had before was not clinically perfectly applicable, because it was not in the continuity of the workflow. Here you have 3D models, you have the motion, you export the motion, you send it to the lab, and you can see in here on the right side how you can adjust inside the CAD software, and in the left side you will see how real is what you did in virtual works. You don't do any more adjustments. What you have in virtual would be exactly what you have in real. No more surprises. You put it inside the mouth of the patient, it will function exactly like you have it before. This is just a second example of how it works inside the 3Shape CAD software. What I showed you before is ExoCAD, and this one is 3Shape. I move to the next step. The 4D dynamic avatar will be so simple in here and so quick on this part. Just want to tell you that when you import the 3D models inside the software, you are creating the dynamic 4D avatar, which means to the STLs, to the upper and lower joint static, you will add the movement and the time. You can add more and more indications inside, or data inside, CBCT, face scan, and everything. And with Modjaw team, we decided to put colors on this patient: green avatar, orange avatar, and red avatar. Green avatar means, according to our analysis, that the function of the patient is perfect. You can use it in the next step. Orange and red avatar means some of the movements you need to re-educate. You need to re-educate, go through an articulator, need to correct the position of the lower jaw to go to the next step. So this is why I want just to say that an initial recording in the first time where the patient is in the clinic is so important, as you can see in here. Initial, provisional, definitive. So for me, I will talk more about the initial, because this is where you can evaluate the initial mandibular position to see if you are going to change or not, and you are going to have the correct one. You will evaluate the functional envelope, the initial one. to see if you are going to keep it or to re-educate it to change it according to all what you recorded. You can communicate with the patient also, where are you going? And you can communicate with the lab the correct information without no loss of information. And this is so cool because green means this is a lab. This is Roselyne who did this part. And I really like the slide because green means straight to the next step. You can use the movement, as you can see here, jaw movement. Green means that you're going to switch between jaw movement and also virtual articulator. Here, red means that the patient needs to go to a specific like treatment, like deprogramming or using a bite splint or something like that to be able to redo a recording and go to the next step after. So this is just quickly about the 4D avatar. Now I'm going to talk about workflows and clinical cases. So I want to share a case, and then we will focus more on the functional evaluation. So this is a case with 52 years old, nothing to report, like in terms of health, no TMG, no pain, nothing. The patient can come for aesthetic and function chief complaint. So let me show you the workflow that we use in the initial. So it starts always with data acquisition. As they say, one workflow fits all. Data acquisition means AUS, picture, face scan, CBCT, and you add to it Modjaw, because all those are static, but you will add the dynamic. And this is a chair time, and we call it data acquisition. You are going to acquire or to record all those data. And the aim of that is to be able to record a complete set of data and a duplicate of the patient. You take it to the next step, which is data processing and manipulation. This step, you are going to work on your virtual patient. As you can see in here, you can create some smile design, 2D smile design, 3D smile design using the data acquired in here. You are going to have a functional evaluation using the dynamic avatar that you have in TWIM, and then you go to the next step, which is the design. Design the prosthesis or the implants. You will have the outputs in here to go to the next step, which is the execution. Execution means like the milling or the printing to go to the surgery or to the banding, to the preparation, to trying a silicone key or whatever you want. So acquire the data or recording the data is data acquisition. Working with the virtual data is data processing manipulation. From the data processing manipulation, you will get STLs and everything, and you are going to produce those, like an execution step. So here, if we talk about data acquisition, use whatever you want, like tools, okay? Intraoral scanners, and then CTs, and then pictures, face scans if you want, and then Modjaw, so to have a complete dynamic set of data. And then if you work to the, if you go to the next step, which is the data processing manipulation, how to work with the dynamic patient. What I want to share in here in the data processing, that it can be like aesthetic evaluation here. So according to the pictures, you are going to have the perfect smile of the patient and create the 3D smile starting from 2D smile. So the platforms are a lot. So what we used in here is Smile Cloud. You can use Smile Creator. You can use Dental Studio or 3Shape. You can use wherever you want. So here, the aim of it is to create a perfect smile design. And then we go to the functional evaluation. This is where Modjaw play the role, because functional evaluation is two things: mandibular position and functional envelope. Mandibular position is to check if you need to change or not. If you need to change, you do it inside Modjaw. So here, use the concept you want. If you are thinking, if you are using jigs, keep exactly the same thing, but use Modjaw combined to that, which means like you ask the patient to stay close, you start the recording, you ask the patient to open, you put the jig and you close. You have this position given by Modjaw. Here, the concept we used is the B manual without any device. And we find that the position of lavatory, which is the MIP, the habitual, and the one where we manipulate the patient are the same. So we decided to preserve this mandibular position. And then we go to the functional evaluation. This is so interesting. So if you take a look on the video on the left side, we gave the chewing gum to the patient. When you look to the static information that we had before, the pictures, for example, you can say, the patient cannot chew, he cannot, so there is no molars, there is nothing, there is no guidance. But when you gave him a chewing gum, wow, I was a little bit surprised. So the teeth still guided, the premolars that he had in here, and then the chewing, he gave me the perfect chewing pattern. So, the perfect chewing pattern is a teardrop. And he was going and he was chewing better than me, let's be honest. And then we said, okay, even if the teeth are not perfectly like shape, but he's giving a good shape, good pattern of the chewing. So I can use the movement to give the perfect shape on the teeth after. So we decided to keep also the motion. So for me, the avatar is green. Do you remember? Avatar is green. So straight to the next step. Exported the XML file, go to a CAD software, virtual extraction of the teeth. This is a lab work. It's not a dentist work, but the lab is working according to the data we gave to him. So here, full arch rehabilitation, upper and lower, guided surgery, implants and everything. So you have the static, which is the aesthetic on the upper, and then he designed the lower. But here, what the lab is doing is perfect. He's replaying the movement to adjust static and dynamic. And the most interesting thing is this. We replay chewing, and when you take a look in here, you will see the contacts. And those contacts, it's the adjustments that you are going to do if you don't have the module. But here, the lab is going to adjust to give me the perfect contact in a static, but also in a dynamic. So after doing all that, the lab continue. If it's an implant project, you go to the implant planification and everything. If it's not an implant project, you go straight to the next step, the execution. Here, set the implants, and then you go to the chair side work, which is the execution, the surgery. So surgery in here was done with Dr. Maxime Gisson and Dr. Marion Paris. And then the most important thing is this. Look at this on the left side. When you put the project in the end of the surgery without nothing, you ask the patient to close. She close in one position. This is perfect. In terms of static, clack, it goes in one position. This is not a miracle. No, it's a game changer because of Modjaw. Here you have the perfect information of the lower jaw if you need to write and change in everything, but it fits perfectly in static. But more important, it's what you see on the right side. When you replay when we did articulating paper and everything, the contacts that were adjusted in virtual are the contacts that we had in here. No adjustments. You don't adjust like for hours. So static is perfect and dynamic was there. The patient feels perfectly with this new project. So then I want to take you through this case, but focus just on the functional evaluation. Do you remember data acquisition? And then in the data processing, we have aesthetic and function, and then execute, and then CAD design. Here we will focus on the functional evaluation. Let's talk about the mandibular position. This is the AOS starting position. So even if you are not a dentist, you know that you need to raise the bite to create a project for this patient. This patient, the project was an all-in-4 in the upper jaw and for the lower jaw extraction of the molar and keep it removable for the lower jaw. And something I want to tell you, look how the patient is opening. The age of the patient was 82 years old. So when you rise the bite in here, if you want to rise the bite and you don't have the module today, you have two ways. The first way is a clinical work, which means using the injection of silicone, using the waxes, using the P manual, and then to scan, or the clinical work. You do it on the patient itself to transfer the position of the lab to the lab, which means you need to scan or to have like a conventional imprints like to send to the lab. And on the left side is the second way, which is to send models in upper and lower in occlusion, send it to the lab, they put it inside an articulator, and they rise the bite according to that. So in the two steps, one, you need shear time, it's time consuming, and the second one without giving reproducible or predictable results. And the second one is a simulation. It's opening straight, let's say. But for this patient, when you record the movement of the patient, and if you take a look on the video, patient is opening a little bit, sliding to one side. And inside Modjaw, 1 second is 120 images. You can stop in any image to be able to use the OVD shift functionalities without losing information, because this position, you don't scan it for the second time. You will export it like this. So it's a new way of thinking. If you ask the lab to give you the aesthetic project in the upper jaw, like you see in here, I can import it inside the software, and according to that, I can decide where to put the lower jaw, because those teeth needs to be in occlusion with the upper project. And then you will finish with a full modeling jaw. When you export that position, OVD shift from Modjaw, you are more precise than whatever you do today, like in the clinic, like injections or scanning. And those are articles that talks about that. So the left one is from Coast Center, and the other one is from a dentist from Hungary. They did comparison where they raised the bite with different concepts, and then in this article, we scanned the position given by a curiosity programmer using Intel scanner and conventional way, and then Modjaw. And in this side, we compared it to an industrial lab scan. And the results were surprising, because here you can see the Modjaw device gives, like in a recording, vertical intermixillary relationship with the trueness of 11 microns. This is perfect. You are precise just by doing a Modjaw recording and exporting a position from there. And here, the jaw tracking system just did improve the trueness value of maxillomandibular relationship recorded. So by just exporting one image, you are not losing information, and you are being more precise than everyone, and you are not losing time. So look at the contacts after static and dynamic. How equilibrated is the project when you put it inside the mouth of the patient? Another case I want to show you, it's also focused on the functional evaluation, okay? But now I'm not going to talk about the mandibular position, but the envelope of motion. I'm showing this video because when you try vaginal or something like that, we use articulated paper, okay? To see where are the contacts when the patient is opening, when the patient is closing, when the patient is going to the right, to the left. But when you have this articulator, what you see, it's an envelope of motion, which means you will see colors everywhere. And for me, when I see colors everywhere, I will say, it's equilibrated. But what you miss in here, it's the time where the contact was there. And to explain to you those ideas is with this case. So this case, practitioner sent it to me and he said, Ouassim, I don't know, let me tell you what he's having. Constant fracture in the upper jaw denture. So for the two or the third time, he breaks those two molars in here. So the practitioner didn't have the Modjaw before, did like a full arch, upper and lower, and then the patient keep breaking those two molars. So he said, okay, do a Modjaw recording and we will check. So by checking the Modjaw recording, I was interested a little bit to something functional and not just the guidance. So look at the breakage in here. I was interested on the chewing movement. And look at this. When the patient started, he was in the middle, but when he started chewing, the lower jaw shifted to one side. So the starting position when he's in open close movement, and then when he's chewing is not the same. So this is what give you more contacts. Do you see this red color in here? It's exactly where the breakage was. So when you do articulating paper, you have contacts here, and you say it's equilibrated, that's perfect. But no, you don't know at what time this contact was there. This is what we will show you. So you can see in here the contacts. Look at the contacts between when the patient is chewing and when the patient is just opening and closing the habitual position. Look at this. There is no contact in here, and look at the heavy contact in the breakage. Exactly. So this is what software will help you. Will give you to enhance the way that you see your patients, because now you have a full image and the dynamic image of how the patient is functioning. And also you can show that to the patient to explain to him that now we need to change the position of the lower jaw, and then to get you in a stable position and to go further for the next steps. So you will enhance the diagnostic, the treatment plan, and also improve the clinical outcomes. So this is what I wanted to share with you today according to 4D dentistry. I just want to finish by saying dynamic information is so important for a complete diagnosis and treatment planning, because static is good, but once you need to change something, you need the dynamic. It's so important to have it. Complete set of data, and what I mean with that, static and dynamic, at least internal scanner and Modjaw, will help to achieve a high level of predictable outcomes. And what I say also, it's high level of customized outcomes, because what you are going to design to the patient is customized to the patient. It's not standard, and then you adjust. It's customized according to the patient. And dynamic avatar is the key for a better communication. What I mean by that is, with the patient, you can explain to him what is wrong now and how to correct it. And also what you recorded, you can communicate it to the lab without any further step and without also losing information. So finishing on that, I just want to thank you, everyone who is here. Thank Danielle and Orem Academy for having me here. And it's not me who said that, but nothing happens until something moves. So thank you very much. If you have questions, please feel free to ask, and I'll be more than happy to answer.
Thank you, Dr. Salmi. I think that was an excellent introduction to Modjaw and how powerful a tool it can be for clinicians in their practice. As you said, we are open for question and answer. If you have any, just put them into the box. And while we're waiting for that, just a few housekeeping things. We will be sending your CE credits to the emails that are you signed up with for the webinar. And if anyone has a need for further information, please contact your local Orem rep. They will pass that information along, and we can maybe set up a demo or something similar to that, perhaps a Zoom conversation to get more information.
Yeah.
We also have a brochure on our website that you can download and take a look at there, and as well as ask for some more information on the website as well. Right. Not seeing any questions coming in right now.
I don't see also on my side, so
you just did such a great job explaining it. Everyone's confident in what they heard.
Yeah, so as I said, it was just an introduction. We can go in depth more and more by more clinical cases and more explanation in depth. But today, just to show how important it is to have this kind of information to be able to treat completely the patient and not just like seeing one point or missing one point. So this is the aim today. I hope that the message was there. So if you don't have any questions, it's okay.
An excellent job. Thank you again. And thank you for everyone for joining us. We look forward to seeing you again for more Orem Academy presentations. And with that, we'll call it an evening and have a wonderful evening, everyone.
Thank you very much, Danielle. Thank you, everyone.
Thank you.
And see you soon. Thank you.